everybody, welcome to my channel Dr. Nutshell, where I explain medical terminologies and diseases in simple terms. So recently, you've probably heard of the measles outbreak in California, and as of today, there are more than 150 people infected with measles. So I thought I would make a video to explain what measles is and the very serious complications it can cause in children. So measles is caused by a virus called rubiola, and rubiola is a very infectious virus. One person with measles can infect to up to 18 people around him. Another way to think about this is one person can infect up to 90% of people around him if the people around him are not vaccinated against measles. To put this into perspective, Ebola virus, which caused a big scare a few months ago in the country, only infects on average 2 people per patient. So measles is about 10 times more infectious than Ebola. And if you're afraid of Ebola, then you should definitely be afraid of measles. So patients who contracted measles first have an incubation period of around 13 days. During this period, patients usually don't have any symptom, but they can walk around and spread this virus to other people. And then patients will develop non-specific flu-like symptoms such as headache, red eye, cough, and nose swelling. So after this period, patients will start having the rash, which is very characteristic of measles. So the rash or red spots will start from patient's face, and it will spread to necks and upper trunk, lower trunk, and eventually extremities. So this from head to toe pattern of spread of rashes is very characteristic of measles. And measles rashes tend to spare or not be on the palms and soles, which is also very characteristic. And after this stage, patient may recover from measles infection. So there are actually some very common and very serious complications from measles. So 1 in 10 children who contract measles would develop severe ear infections, which can cause permanent hearing loss in these children. And measles can also be very deadly. About 1 in 200 people who have measles can develop pneumonia or lung infection. So these people need to be hospitalized. And this lung infection is the most common cause of death in measles. So measles patients can also develop encephalitis or the swelling of the brain. And this is very deadly complications too. So overall, about 1 in 500 to 1,000 people who have measles can die from this disease. So it's a very serious disease. And currently, we don't have treatment for the disease. So we rely completely on vaccination to eradicate this disease. So to protect your kids and your family against this spread of disease and to eventually eradicate it again in the United States, so please vaccinate your kids and tell people around you to do vaccination. And if you're still on the fence about whether vaccinations are effective or not, whether they're safe or not, whether they cause autism or not, please watch my next video on the myths and truths about vaccination. And the bottom line is vaccination is very safe and effective. Thanks for watching. See you next time.